These two groups of drugs attempt to solve the problem of type 2 diabetes at the root cause, which is nutrition. They do so by acting on the hunger centers in your brain to suppress hunger and appetite. It follows that if you're not feeling hungry as much, you're not going to be eating so much food. This can potentially reduce on your insulin levels and contribute to better blood sugar control. On paper, this all sounds like a good thing. And yes, in some way it is. However, we need to remember that if somebody is not eating enough, even if you are solving the other side of the web of bondage, which is reducing the insulin levels, you are increasing on the physiological stress, and hence you're also causing elevated levels of cortisol, which can result in muscle loss. Actually, Ozempic has been associated with up to 40% of that weight lost being muscle. And as long as you continue to lose muscle, you are never going to sustainably lose fat and take control of your blood sugar. And also, the primary reason that insulin rises is not eating too much food. It's actually eating the wrong type of food. I can have one person eat a smaller amount of food, but if it's the wrong type, so lots of refined carbohydrates, this person eating the wrong food will most likely have a higher relative spike in their insulin levels. So these GLP-1 receptor agonists and the gliptins are not really addressing the problem of nutrition adequately, but also they're associated with increased risk of inflammation of the pancreas, what is called pancreatitis, increased formation of gallstones, which can result in inflammation of the gallbladder. And also, some studies have shown that the GLP-1 receptor agonists particularly can be associated with an increased risk of development of thyroid tumors and development of certain mental health conditions like depression. So, the GLP-1 receptor agonists and the gliptins may have benefits, but they don't adequately address the root cause, which is the wrong nutrition, and they potentially worsen chronic stress, which is another very important cause of insulin resistance and therefore type 2 diabetes. Just like the GLP-1 receptor agonists and the gliptins, these drugs do not solve the root cause of the problem, which is predominantly eating the wrong type of food. Instead, by them suppressing carbohydrate digestion, which means less glucose gains access to your blood through absorption, it limits the amount of energy available to the body in the form of calories to sustain its function. This further worsens the chronic physiological stress, resulting in the several negative effects we've already discussed, of which the main one is insulin resistance.